This video explains how Rehab 1584 tracks medical and EMS-related exposures, ensuring that non-fire risks are consistently documented and not overlooked. While fireground exposures are often the focus, EMS calls pose significant risks, including bloodborne pathogens, drug exposure, and respiratory hazards. These exposures occur daily and must be captured just as reliably as fire-related incidents. Within Rehab 1584, exposure tracking begins at the time of the incident. Layer 1 establishes the environment, which may include unsanitary conditions, known infectious risks, or hazardous substances present on scene. As personnel complete their patient care activities, Layer 2 captures job-specific functions, such as patient contact, airway management, or treatment in confined or contaminated environments. Layer 3 records exposure modifiers, including direct contact with bodily fluids, suspected drug exposure, or extended time in high-risk environments. Layer 4 captures the psychological toll of EMS response. Each factor carries a research-backed severity weight. Violence or threats against providers is weighted at 9, based on studies by McGuire and colleagues showing that over half of EMS providers experience workplace violence. Suicide and self-harm incidents also carry a weight of 9 due to the moral distress documented by Aldrich and others. Neglect and abuse cases, especially involving children or the elderly, score 9 based on SAMHSA findings. Moral injury from system limitations is weighted at 8, reflecting research by Litz on institutional betrayal. Substance abuse and overdose scenes carry a 6, and repeat patient compassion fatigue scores 5, both reflecting cumulative burnout research by Crow and Donnelly. These weights are grounded in peer-reviewed occupational health studies by Rieger, Beaton, Litz, and Niosh. After the incident, Layer 5 documents post-exposure actions, such as decontamination, use of wipes, or gear cleaning, ensuring that mitigation efforts are also recorded. This structured approach ensures that medical exposures are documented in real time, not reconstructed later, creating a consistent and reliable record across all EMS responses. Medical exposures are often cumulative and easy to overlook, but they carry real long-term risks. And at the center of this system is the CEI Exposure Index, an industry first that turns scattered exposure details into a structured, defensible framework for cumulative risk. By capturing these exposures consistently, Rehab 1584 helps improve awareness of daily risk, support health monitoring over time, provide documentation for occupational illness claims, and ensure accountability across all types of incidents, not just fires. Rehab 1584 ensures that every exposure, fire or non-fire, is captured, structured, and accessible, giving departments a complete picture of firefighter and EMS risk through the industry-first CEI Exposure Index. Exposure doesn't stop at the fireground. Rehab 1584 ensures EMS risks are tracked with the same consistency, accuracy, and accountability. This is Rehab 1584.